Hello, and welcome to NAMB's webinar on medication management. The purpose of this webinar is to familiarize members with the standards for medication management and to demonstrate how they apply to nursing practice. This webinar will take approximately 15 minutes. In this presentation, we will go over what medication management is, the standards for medication management, how they apply to nursing practice, and we will finish with some resources for medication management. What is medication management? Medication management is more than just passing medications to clients. Medication management is defined as a client-centered practice that optimizes safe, effective, appropriate drug therapy. It is a shared responsibility between the entire healthcare team and the client. Medication management requires nurses to use critical judgment, critical thinking, and evidence-informed decision-making. As you may have noticed, NAMB has transitioned from a medication administration standard to a medication management standard. The reasoning behind this is that providing medication to a client is a comprehensive process which involves more than just administration of the medication itself. The standards for medication management are intended to complement NAMB's standard of practice for registered nurses by describing nurses' accountabilities and responsibilities in medication management. They are not intended to replace legal advice or employer policies. There are 4 principles, also called standards, that outline the expectation regarding medication management authorization, competence, safety, and collaboration. Although they are presented in a linear format, the medication management process is not linear. These principles are accompanied by indicators, which are developed to illustrate how each of the standards are to be met. The first standard is authorization. Nurses need to know the medication management practices that they are authorized to complete. Authorization for nursing practice is granted through legislation, regulation, and/or policy. Nurses must know their individual scope of practice, their legislation, and agency/employer policies that influence their practice. Here are some key points related to authorization. Nurses require medication orders from authorized prescribers for medications that are within the prescriber's scope of practice. Authorized prescribers in New Brunswick are physicians, nurse practitioners, optometrists, dentists, pharmacists, midwives, veterinarians, and physician's assistants. Nurses should only accept verbal medication orders in emergent, urgent, or exceptional situations. So when can verbal prescriptions be acceptable? Situations where delay in treatment place the client at risk of harm, for example, a code, when the prescriber is not present and urgent or emergent direction is required to provide appropriate client care, for example, a warfarin prescription, when the prescriber is away from the client care area where access to the health record is not possible, or when the prescriber is consulting via telehealth without the ability to enter their prescription into the health record. Nurses must comply with relevant legislation for medication management. Federal and provincial legislations are available in Appendix B of the Standards for Medication Management. Direct orders are those that only apply to one client, and directives apply to more than one client when specific conditions are met. Orders for controlled substances must always be direct orders. Nurses may also provide samples of medications to clients pursuant to an authorized prescriber's order. The Food and Drug Regulations include nurse practitioners as a practitioner to to whom drug samples may be distributed since July 2020. This chart can be found in Appendix A of the Standards of Medication Management. It will help the nurse decide if the medication order is clear, complete, and appropriate. It also suggests important things to consider. Let's look at the different questions. The first question to ask is the order clear, or do I understand the order? If the answer is no, the nurse must consult with the prescriber. If the answer is yes, the second question to ask is the order complete? Does the order contain all of the information that I need to administer the medication safely? This would include the client's full name, date of order, medication name, frequency, strength, quantity, and concentration where applicable, route of administration, purpose of PRN or as-needed medication, authorized prescriber's name, signature, and designation. If the answer is no, the nurse must consult with the prescriber. If the answer is yes, the third question to ask is the order appropriate? Is the order appropriate considering the client and the client's current condition, health history, medication history, and other medications that the client is currently taking? If the answer is no, the nurse must consult with the prescriber. Medication orders must only be accepted if they are clear, complete, and appropriate. Standard 2 is competence. Nurses must ensure that they have the knowledge, skill, and judgment needed to practice medication management competently. In compliance with Standard 2, nurses must ensure their medication management is evidence-informed. For example, using evidence to know if the medication is appropriate for your client and following up if you are concerned. Assess the appropriateness of the medication management by considering the client, the medication, and the practice environment. Knowing the limits of their own knowledge, skill, and judgment. Practicing according to employer policy and not performing any medication management that they are not competent to perform. Standard 3 is safety. Nurses promote safe care and contribute to a culture of safety within their practice environments when involved in medication management. To apply Standard 3, nurses involve the client by seeking information about their medications as needed, providing education about medication management, and involving the client in medication management decisions. Monitoring the client before, during, and after medication administration, and intervening when necessary. Promoting and implementing safety precautions as they prepare, handle, administer, store, transport, and dispose of medications. Take action to minimize the risk of harm from medication errors or adverse drug reaction. Reporting medication errors, near misses, and adverse reactions in a timely manner. Standard 4 is collaboration. Nurses collaborate with the client and other members of the healthcare team when planning for, implementing, and evaluating medication management. Collaboration promotes consensus building and working together on common goals, processes, and outcomes. Nurses collaborate as well as communicate and consult with the client, unregulated healthcare providers, and other members of the healthcare team. This process is integrated throughout all aspects of medication management to optimize positive client health outcomes. In compliance with Standard 4, nurses involve clients in the management of their medication, document in accordance with legislation, standards, regulatory requirements, and employer policy, collaborate in the development, implementation, and evaluation of system approaches that support safe medication management within the healthcare team. Let's now talk about the decision tree on medication management. This decision tree integrates all 4 standards related to medication management and is meant to guide nurses in their medication management practices. It can be found in Appendix C of the Standards for Medication Management. Let's have a look. In the first yellow square, it says, is the proper authorizing mechanism in place? If the answer is no, do not administer the medication. And if the answer is yes, continue down the decision tree. In the second square, the question is, do you have the competence to administer? For example, proper knowledge of medication, skills to administer, judgment to identify and respond to outcomes. If the answer is no, do not administer this medication. If the answer is yes, then continue down the decision tree. In the third box, the question is, have actions been taken to ensure safe care? For example, human and technological resources to monitor and intervene if needed, systems in place to support safe medication administration, collaboration with client and other members of the healthcare team. If the answer is no, do not administer this medication. If the answer is yes, continue down the decision tree. The fourth box in the decision tree reads, have you assessed client factors? For example, identify client, assess appropriateness, and verify consent. If the answer is no, do not administer this medication. If the answer is yes, continue down the decision tree. The fifth box in the decision tree is administration of the medication. The last box in the decision tree is evaluating the outcome of the medication that was administered. To help nurses better understand medication management, a frequently asked question document was developed and is available on the NAMB website. If you have specific questions regarding the medication management standards, please contact NAMB at namb@namb.nb.ca or call 506-458-8731 or toll free at 1-800-442-4417. Thank you for listening to this webinar, and I hope it has enhanced your knowledge on the standards of medication management.